Hello, everyone. It's 8:30 a.m. in Hong Kong, 12:30 a.m. in London, and 8:30 p.m. right here in New York City. Welcome to this live global conversation about the COVID-19 pandemic. My name is Sree Sreenivasan, and I'm the Marshall Loeb Visiting Professor of Digital Innovation at Stony Brook School of Journalism. I'm honored to moderate this discussion brought to you by the University of Hong Kong. Today, our guest is one of the world's foremost experts on the pandemic and how we can stay safe. Professor Gabriel Leung is Dean of Medicine at the University of Hong Kong. He's the inaugural Helen and Francis Zimmern Professor in Population Health and holds the chair of Public Health Medicine. He was Hong Kong's first Undersecretary of Food and Health and has degrees in medicine and public health from the University of Western Ontario, Harvard, and HKU. Welcome, Professor.
Hi, how are you, Sree?
Great. Thank you for being with us and making time for this event.
No, thank you for the honor and the privilege.
Well, we need your guidance at this time, and we're taking questions from around the world via the hashtag AskHKUMed or by email fightcovid19@hku.hk. You can also tweet us at the Faculty of Medicine's handle @HKUMed and GM Leung HKU and @Sree. Things are changing on a daily, even hourly basis, so please check out HKU's new Fight COVID-19 website, fightcovid19.hku.hk. We have questions that have come in and we're just going to ask them, and we look forward to hearing your thoughts. So, opening question for you. The Hong Kong government has announced arrivals from the US and UK must go into compulsory home quarantine. What does that mean, and what's the rationale behind this policy?
I think, as you have seen around the world, and I think Canada, your northern neighbor, has been the latest to announce these border restrictions. And really the whole point of these mobility restrictions amongst travelers is to try to reduce the importation or exportation of potentially infected travelers outside of the boundaries of one's population. Now, there are two reasons why one might wish to do that. The first one, which I think is slightly more obvious, is that you wouldn't wish to have potentially infected travelers coming into your country and then potentially seeding a self-sustained local epidemic. So that's the first reason. But given that this is already a pandemic, the virus has probably established a sufficient foothold in most countries around the world. That first reason then needs a second reason to buttress that argument. And the second reason is so that there is not going to be a huge, unsustainable pressure on the surge capacity of hospital beds and the health system in general. So that second reason has actually played a more important determining role for countries who decide then to restrict traveling mobility of international passengers.
Thank you. Now, the Hong Kong government is also, that's just one of the governments obviously involved in all of this. We also have been reading about the UK government strategy for this pandemic. There's confusion about the herd immunity proposal and what it means. So let me ask you straight up, what is your advice for Prime Minister Boris Johnson?
Well, first, advisors advise and really ministers decide. I believe that was from Margaret Thatcher back in the day. So I wouldn't wish to interfere with any other countries' policy decisions. But let me just try to give you my understanding of the science or the assumptions behind the UK's policy as I understand them. So the first presupposition is the UK thinks that it has a very important, perhaps silver bullet, and that is massive social distancing and non-pharmaceutical interventions that we have seen China, South Korea, Hong Kong, Singapore, and Italy of late deploy. But I think that they are presupposing that this so-called very drastic, even draconian bullet can only be fired once, i.e., you cannot keep locking down whole populations or asking people to adhere to very, very drastic social distancing measures. And therefore, you could only do it probably for a month, maybe 2, maximum 3 months, something like that. And so that's why they have, I think, as I understand it, decided not to use it quite yet because they don't think they're at that stage of the pandemic in the UK yet. Presupposition 2, and that is to say that they believe that they could probably, with their policies, segregate by age in terms of social mixing, such that they could preferentially protect those who are in the older adult age group. And the reason you need to protect them as a priority is because they are more susceptible to being infected. And once infected and show symptoms, they also have a much higher likelihood of having very severe disease or even dying from the disease. So I think that these two presuppositions is what has led to what we now learn as the UK policy. So apparently, if you look at the numbers, these are still manageable levels for their health system. And I think the overarching goal is that the health system, the National Health Service, actually does not find itself overwhelmed, and that its surge capacity at any point in time can and will deal with the surge in patients. So they're trying to spread out the flow of seriously ill patients into the hospitals. Now, clearly, there is a lot of assumptions, a lot of calculations, a lot of estimations, and quite frankly, a lot of trade-offs behind that decision. And I think that that's why people are now using a corollary or even a side effect of that strategy and giving it its moniker, the herd immunity strategy. But I think that herd immunity is merely a corollary. So if you allow this to go and essentially infect the population, then some of the people are going to be infected and then recover and then be immune to it, presumably. And that's where the herd immunity corollary comes in. I think that it's not a risk-free proposition. How you can segregate by age and preferentially protect older people, how you can control the rate of infection, the so-called burn through of the entire population, such that you would be able to tune it and time it that you do not overwhelm the National Health Service. I think this is technically a difficult policy to pull off, but if they were able to pull it off, it would be a stroke of genius. However, I'm not sure that I would have recommended this strategy because it is so tricky to make sure that all the pieces fall into place at the right time in order to pull it off. And that is why you see that the majority of countries in the world have actually taken what I call the East Asian approach. So China, South Korea, after a very large or several very large outbreaks, were able to, using our strategy, actually bring down the infection and the epidemic curve quite substantially and quite successfully, at least for the first wave. Hong Kong and Singapore never really has had a first wave yet. We have never really had a self-sustained local epidemic yet. Everything that we've got are highly clustered. About half of them are imported cases. And if you look at whether each person who is infected can, on average, pass it on to another one, neither Hong Kong nor Singapore have actually consistently and persistently gone above that threshold. So I would have preferred to take this approach as opposed to the much more sophisticated, but I think also much riskier UK approach?
I think kind of high risk, high reward if it works, but if it doesn't, then there will be problems. If you're just tuning in, we're talking to Professor Gabriel Leung, the Dean of Medicine at the University of Hong Kong, one of the world's top experts on the crisis at hand. Please tweet us, hashtag AskHKUMed, and also follow us at HKUMed. Our next question is about the United States. Right now, we're hunkered down in New York. You've seen the news. In San Francisco, they have said 7 million people must shelter in place. And in all of California, they've said no one under 65 should step outside. What should the US be doing? How do you grade how they're doing so far? And what is your advice to President Donald Trump?
I shouldn't pretend that I would be able to advise your president. He is surrounded by some of the world's foremost experts, and chief amongst whom is Dr. Tony Fauci of NIAID, of the National Institutes of Health. He probably has more experience than most of us around the world in dealing with global pandemics. Now, nevertheless, I think that what you've seen in the US, at least in the past few weeks or even past couple of months since the world has come to know COVID-19, there's been a slow start and a stuttering start, particularly in what I believe to be the single most important strategies in fighting this in the containment phase, and that is testing, testing, and testing. You need to be able to run enough tests to identify potentially infected individuals, quickly isolate them for treatment for their own sake, and more broadly for the sake of public health. Then you need to trace their close contacts and then quarantine them so that they do not have the potential to go on and infect others if they indeed convert to being infected themselves. And that is how you control the stuttering beginnings of any epidemic, in particular this one, which tends to spread somewhat more than others in the pre-symptomatic stage. So in a very recently completed report, we have estimated that about 40% of all the infections of COVID-19 took place during the incubation period of the index case. Now, this is a very substantial proportion and bears resemblance to influenza. Not SARS, not MERS, they're close coronavirus cousins of COVID-19, but actually to influenza, which, as we know, is very, very infectious and very infective. That is, it spreads very quickly. In fact, if you look at the case numbers around the world, this has indeed been borne out everywhere. So I think that testing and tracing are key strategies. Now, clearly, I think the consensus is that the US has not been as proactive or as quick on its feet in the first few weeks. But I'm very, very glad to see that national capacities, drawing particularly not only on the public sector, but on the private sector labs, are now ramped up everywhere. So I think that is a very, very good sign. And of course, the very dramatic or drastic measures that San Francisco has taken in the last few hours. In fact, I was just watching the telly with the mayor announcing that I wouldn't call lockdown, but certainly a population-wide quarantine, self-quarantine at home. And I think that is going to dramatically reduce the so-called force of infection in San Francisco Bay Area, because you are essentially severing potential chains of spread between people. So the only people you will be closest to and can potentially, if you're infected, go on to infect would be your own family members. But you go home every night, don't you? So I don't think that you are placing your own loved ones at any particularly high risk above and beyond what you would be anyway. So that is why it is so important to practice good cough etiquette, sneeze etiquette, hand hygiene, and all that, even when you're at home, so that you
Wow, even
go
at
on-
home, okay.
even at home, so that you can protect your loved ones, especially if you lived with older folks, because let me say it again, they are at highest risk.
When you hear public officials say shelter in place, but this is not a time to panic, that is when people panic. So what is your message to Americans who frankly are scared at this moment of what could happen in the days, weeks, and months ahead?
My wish, and I don't have any shares in any company, my wish is that the mug or any paraphernalia that has the very, very well-known phrase, keep calm and carry on, would oversell over the next few weeks. That, I think, is the mantra. Keep calm,
Okay,
stay sane, and carry on.
I love that. Great advice for all of us. Now, we only have a few minutes left with you, and we have so many questions. So we're going to go to a lightning round, if that's okay with you, Professor. And this question came in from @Webmester, who says, what have we learned about the infectivity of children, and how did the virus spread on cruise ships while everybody's quarantined in their cabins?
Okay, the easy question is the second part of the question. So I don't think that people are locked in their cabins 24/7. People do come out for exercise, for meals, and that is how people mix. And of course, don't forget about the crew who has to serve and service the customers and the passengers on board. And they are oftentimes, if they're infected especially, the vectors of how these infectious diseases go around. The first question about how infective are children, I think there are two parts to it. So some countries have closed schools and some countries have kept schools open. And I think that the key questions that we have to answer are twofold. One, are children actually as likely to get sick if they fall ill? Now, that goes to the question of susceptibility. So are children as susceptible as adults? Now, there are beginning to be some early evidence from Shenzhen and from Wuhan, both cities in China, to suggest that children are just as susceptible as adults. That is not confirmed yet, but that seems to be the case. Now, they can be as susceptible, that is, they will be as easily infected, but they don't seem to fall as seriously ill. So when you look at the cases, the case count has a very small proportion of children. So it appears tentatively that children are as easily infected as adults, but they don't necessarily get ill or display symptoms. Then the third and the most important question is, do they go on and infect others just as easily as adults? That is the major unknown, and we really don't have any idea just yet. We would have to look at, amongst other things, serology. That is, do people have antibodies? And we need to look at it by age groups so that we know how the mixing pattern and the infection patterns might correlate. And that's how we would be able to find out the answer to that question.
Thank you. A question from Andy Bobandy 15, who says, when diabetes is mentioned as a high risk group for COVID-19, does this mean most diabetics or mainly those with uncontrolled diabetes?
Now, clearly, uncontrolled diabetics are going to be at even higher risk than diabetics who have their sugars under good control. But I think that as with SARS, as with MERS, as with influenza, you are going to get the more serious, the more complicated, the more severe cases, and even the more fatal cases amongst those who are older adults, and in particular, older adults who have multiple pre-existing conditions, especially if they're not under good control.
Thank you. An email from Belinda in Malaysia who says, can you share with us an example of a city, state, country that has done really well in dealing with the pandemic, be it the government, public-private partnerships, communicating to the public, or standards of practice in healthcare?
I think every government has been trying the level best. I think that other than what government does, it really depends on how the entire society come together. So societal solidarity, societal adherence to government recommendations, the ability to execute these simple social distancing, but can very often be lonely experiences, especially on a sustained long-term basis over weeks or even months, as some of the people in Wuhan have actually been experiencing now for a good 2 months. So I think that it is that collective goodwill and solidarity that really determines whether you would be able to come through as a society or as a city, as a state, as a country, COVID-19 pandemic. Now, that said, I think that a lot of people have told me, and I would tend to agree, that the risk comms or the risk communication of the Singaporean Prime Minister has been very impressive. He has spoken twice. Most recently, a few days ago, when I was actually in Singapore, so I watched him on television live while I was there. So he has been extremely impressive because of his grasp of the situation and the way that he can communicate in all three languages, official languages of Singapore, to the people of Singapore. So that would be one example of good risk communication. And I think that if you look at Singapore case counts on a per capita basis and Hong Kong case counts on a per capita basis, quite a lot of people acknowledge that Singapore has done very, very well in keeping COVID-19 at bay at a fairly low level. Now, Singapore has about 40% more cases than Hong Kong with a third fewer people. So by extension, even if I say so myself, I think Hong Kong has done not too badly.
Okay, yes, you shouldn't be embarrassed to take credit for the good work so far that's been done.
No, the credit belongs to the Hong Kong people. Absolutely. Yeah, that is the only way that we can get it done.
Absolutely, I understand. Folks, we're getting so many questions and comments and thoughts coming to our professor here, so please keep them coming. Even though we may not get to your questions tonight, the hashtag AskHKUMed will stay open and we will follow it, and we'll be continuing a series of conversations. So please keep tweeting at using AskHKUMed, and of course at HKUMed for the Twitter handle, so you can follow the handle and get more thoughts and questions. All right, here's a question from New York City at Carly ETT117. Says, I live in New York and I'm traveling to Minnesota. I'll be at the home of my 70-year-old parents. Should I self-quarantine for 14 days? I don't know what stage she's asking, but over to you, Professor.
I think that if I were you, I would delay that trip unless it's absolutely necessary, especially you are visiting your folks who are over 70, and may they live long and happy lives. But as part of that, you would need to make very sure that you protect them from COVID-19. And so my recommendation would be that you try and delay it. And if you must make that trip, and if there is no other place to live, then make sure that you do very good distancing, however much that it is possible within that household, and make sure that you practice very good personal hygiene and protect them and try and stay away. You love them by keeping away, even when you are under the same roof, for at least a week. And generally, about half the people, if they were infected, would have shown symptoms by day 5, 6, or 7. So that's really the advice.
I should also say that you mentioned hand washing, and this is a big push here in America for hand washing. 20 seconds is a long time, Professor. People are now discovering that it's not so easy to do it, and it's not enough just to lightly, you've got to get in there, right? And get in and really clean the hand.
In fact, Dr. Tedros, the Director General of the World Health Organization, has launched a hand washing challenge, which is now gone viral on Twitter. And so I would encourage everybody to really go and try to wash your hands for 20 seconds by the clock, and you would realize that it seems like an eternity.
Yeah. We have so many more questions in. At Alf Z. Rodriguez says, the Philippines currently lacks test kits for the virus. What should the country do?
I think that test kits are not going to be available to every country and every city in every country, obviously, because the whole world needs test kits. I think that the alternatives are, and China did that for a while at the very beginning, and also even in the middle of the outbreak in Wuhan and Hubei province, the epicenter. So they actually had a case definition where they would clinically diagnose COVID-19, mostly based on CT findings, so chest radiographs, which do show a very characteristic ground glass pattern in the lungs. So I think clinical diagnosis is also very important. So if you don't have the test kits, then I think clinical diagnosis as well as using the radiographic diagnosis would be good adjuncts. And in any case, if you do feel sick, if it's mild, and if you don't have access to a hospital bed, then stay home, self-quarantine, self-isolate. Make sure that you monitor yourself and your symptoms closely. And if you feel that you are not doing as well as you should be, then you should go and seek medical care immediately. And for most people, this is going to be a mild infection, and you should get better by yourself. And I think that that is what some countries are doing, who either don't have enough test kits or that their hospitals are completely overwhelmed. So not everybody, including the mild ones, or especially the mild ones, can access good medical care. So this is very important for low and middle income countries, and it would be a slightly different strategy than, say, where you are on the Upper West Side.
Of New York City, yes. Here's a question, because a lot of this seems to be on how good your immune system is, kind of determines how well you're going to survive any of this. So what are some things you can do? There's a question from Ms. Wong who says, what can we do now that there is no vaccine? What are things we can do to improve our immune system? Any other tips you might have?
Eat healthy, try to exercise. Now, clearly the gym is not the lowest risk place at the moment, but go outside where, if possible, go to open spaces, keep exercising, or even just at home, try to keep active, and make sure that you are well rested. So these are very, very simple measures. And quite frankly, if you are battened down at home, it's probably a lot easier to be well rested and to eat right than when you are very, very busy at work and you don't get home until very late and probably don't have time to cook your own meals.
Great. We're almost out of time, but a question from Dr. Jim Schofield, who says, do you think that pooled PCR testing of samples for COVID-19 antigen could be of merit?
Yes, I do. Especially when you don't
have
Can you
translate that for us? Yeah, can you translate
So essentially, this is really, again, about lab capacity, and it's also about reagent availability. So it's almost like in some airports, you know, when they test for explosives. So they would sometimes do it individually, but some airports actually do it collectively. So they use that sticky swab and they touch, say, 10 passengers, and they swab them all at the same time, and then they put it in the machine, test it. If it's negative, that means that all 10 are negative, and then you can let them go. But if it's positive, then you would just individually swap that subgroup of people. This is the same idea. So if you combine the swabs from 10 or 15 people and use that as a single test, if it's all negative, it means that the whole batch is negative. So it increases throughput and saves on the reagents.
A question about America and learning from what has happened in the other countries like China and Japan in particular. Any thoughts that we can learn from?
I think that the lessons learned is that even though there may have been a very large outbreak, particularly in the epicenter in Hubei province in mainland China, or for that matter, in, say, Hokkaido in Japan, or in Daegu in South Korea, you could actually bring it under control relatively rapidly over a matter of 2 or 3 or 4 weeks if you really apply very stringent social distancing measures, very, very drastic, some even called draconian measures of home quarantine, of stopping really societal functions for a few weeks, so that gives the necessary time for the infection to sever links in terms of the transmission chains. So it is possible even after very large outbreaks. And the lessons of Hong Kong and Singapore, and to a certain extent, Macau and Taiwan, would be that you could actually keep it from taking off in terms of a local epidemic if you start things early and keep these measures in place for as long as possible.
I know you get this question all the time. What are your predictions about when this will come under control, or when will it end? What do you say to those questions?
I think that the first wave has swept mainland China already. So the big question is there going to be a second wave? And if so, how big and how quick? As economic activity resumes, and possibly classes are going to resume as well in the near future. So that obviously is a big question, because now there are quite a number of imported cases back into China. So those infected seeds, so-called, may actually touch off another round of infections. That is always a possibility. Although with the testing strategy and the tracing strategy of China, hopefully, even if there is a second wave, it would be a controlled one, and that the magnitude would be much smaller. For, say, the European continent, the UK, America, you are seeing really the very exponential, explosive rise of the first wave. So that's going to take a few weeks at least, if not a month or two, to actually complete that first wave of infections. And then, of course, we have had a very large outbreak in Iran, but not much else being reported from elsewhere in the Middle East. But that doesn't mean that there isn't or hasn't been an outbreak. Africa, of course, has also been reporting some initial cases now. India and Indonesia, the other two very large populations in Asia, haven't reported that much yet. But again, is that because of testing capacity, or is that because of true absence of infection? So I think that you are seeing the phased first waves asynchronously going around the world. And what you will have to do is to wait out a few months, 2, 3, 4 months at least, in order for that first global wave to complete its own course. And then as the Northern Hemisphere goes into the summer, perhaps you might begin to see some similar pictures appearing in the Southern Hemisphere. Although when everybody is susceptible with a completely new pathogen, seasonality or seasonal forcing may not play as prominent a role. So I think we are going to have to adapt to the new normal for probably the better part of the rest of this calendar year. And then let's see what happens depending on how this first global wave goes, what is the serology results show in terms of protection of people who have been infected and then recovered, and then the availability of a possible vaccine next year.
Before you go, a question from California. Betsy asks about dogs and pets and their connection to all of this. Can they carry on their fur the materials that could make other people sick or make humans sick? Can you talk about that?
Theoretically, yes. And in fact, we've already seen a documented case of an infected person in Hong Kong passing it on to her dog. And that is something that we also observed during SARS. So coronaviruses tend to reside in mammalian hosts. So humans probably caught it from a small mammal, which was in a market being sold as food. And the ultimate reservoir, as best as we can tell now, is the Chinese horseshoe bat. So these are all mammals, and there is no reason why cats and dogs do not get infected if they are exposed. But we don't have good evidence or good documentation of whether they could actually potentially spread it back to humans. Although, in theory, of course, there's no reason why they can't. But there is no clear evidence either way at the moment. I don't think we should worry too much about that for the moment. That's not the major route of infection, but it is something that pet owners may wish to be very careful about.
So keeping even animals in social distance from each other when you're walking the dog, for example, is probably a good idea. And Professor, we want to give you a final thought and a final message to people watching all over the world right now and later on the recording.
I think that COVID-19 is scary, but I don't think it's an insurmountable challenge. I think that we all need to pull together. We're all in the same boat. Global solidarity. Let's help each other to get through this. We will be able to get through this. We just need to keep calm. We just need to keep healthy. We need to keep sane. And let's carry on and make very sure that we make, which is not a very good situation, the best as we can. And we will overcome.
I love your optimism and your frank conversation with us. On behalf of the entire planet, thank you so much for all you're doing. Hope you'll come back and share some of your thoughts in the weeks ahead.
Thank you, Sree, for the opportunity, and thank you for doing it all the way from New York City.
Thank you. And you've been listening to this conversation with Professor Gabriel Leung, Dean of Medicine at the University of Hong Kong. Please follow at HKU Med, and please keep tweeting #AskHKUMed. He is on Twitter, so please follow him. Everything he can speak on Twitter will be of something of interest to you. He's at GMLeungHKU, and I'm at Sree in New York. He's in Hong Kong. Thank you very much for watching, everybody. Good night, and we'll say namaste. Thank you.